Hey Nook, how you going?
Good, thank you. How are you?
Great, so we're all ready to go in?
Yep.
Okay, what we need to do is just book and wait.
Yeah.
Okay, so come down this way.
The Royal Children's Hospital in Victoria is one of the world's leading hospitals in the treatment of epilepsy. The nurses who work in the hospital's neurosciences ward are specialists in epilepsy nursing and use their skills to help families negotiate both the management of their child's condition and the hospital system.
Well, I work in the Neuroscience Centre here at the Children's Hospital, and so we are managing families and children who have a variety of neurological conditions.
Our department is one of the leading epilepsy communities within all of Australia and actually internationally. We bring families from different countries, from Fiji, from New Zealand, even from the United States, to come here for our specialised treatment. Without the Children's Epilepsy Program, there'd be a lot of children out there who wouldn't strive to make the best of having epilepsy or for actually having their epilepsy cured.
Epilepsy is a disorder of the brain where the electrical activity is not working properly, and often it presents as some sort of seizure, and most people in the community would recognise a seizure as when someone falls to the ground and will have movements of their arms and legs, sort of shake and may make noises. But seizures can present in many sort of types, from just blank staring to perhaps just one arm moving, or maybe just their head turning to the side. So I guess that's how I would describe it. So you've had the blood test?
Yes.
And my role is an epilepsy nurse coordinator, and so I'm involved with educating families in management of epilepsy at home. We coordinate families who are coming for what we call video EEG monitoring. So that's a special EEG that needs to be conducted as an inpatient in the hospital, where they're videotaped with electrodes on their head. So we capture the seizure electrically and also in full view of the camera. And we also are involved in coordinating families who are coming for surgery or a surgical workup. Families have different ways that they have to cope with seizures. They also have to deal with investigations and often lots of appointments with doctors and other therapists maybe. As part of our role, we try to coordinate that type of process so that families get to see the doctors and the therapists on the same day and get to see us as well.
And it's my role to be there as a person to find resources for them, or even just to be a person on the end of the phone when they ring up and say they've just done this and I'm not quite sure, and I just reassure them and go and find the doctors, and just to coordinate everything like that and to support the families on a day-to-day basis.
Which way is the doctor working?
These epilepsy nurses are passionate about their job and have the satisfaction of knowing that they can make a real difference to the families they deal with.
Well, I hope that they've got someone they can call any time that they're in trouble. We often do a lot of phone contact with families, so we're almost like a first point of call for some of them. I like to think we make a difference for them when we are trying to coordinate appointments. That's all streamlined, so they don't have to come 5 different days for different appointments. It could all be on the one day. And I like to think that their families and we develop a relationship and a rapport, and that they can call about not just, I guess, medical problems, but to talk about other issues that might be out there, and that hopefully I'm a sympathetic ear, and that's how I hope to make a difference.
Pop it on the device, just gently, with our wand, you know the wand. We'll hold it there, and we'll have to count. And we'll go ready. 1, 2.
Neurosurgery and epilepsy I find exceptionally fascinating, and it's just developing more and more each year. We're seeing so much progress and so many benefits for the children these days that we weren't seeing even a decade ago. So I suppose that's why I love my job, and to chat to the families, and I love children, so I get to combine it all really. The current and everything is
I love that every day is different. We come to work and it's not the same. I can be thinking I might be going to be doing one thing one day, say perhaps just going to a clinic, but then my day changes dramatically if, say, I need to help a family, or some staff need help with education on the ward or something like that. So it's just so varied and very challenging, and dealing with kids, best part of my job.